And we have a terrific panel coming up next with some extremely distinguished thought leaders in digital healthcare. Again, a riveting section coming up here with Doctors Lazar, Nizami, and Choksi. And on that note, handing the digital lectern over to Sara Choksi. Dr. Choksi.
Thanks, Ken. And thanks, Lisa. Thanks, Kelly. That was a really interesting session. Really appreciated it. I'm really happy to have a quick conversation today for you all with Jason and Nassar. And was hoping we could start with you, Jason. Can you just, for the people listening today who, don't know you, can you tell us a little bit about yourself, your background, and your role at SUNY Downstate?
Sure. Good afternoon, everybody. I'm Jason Lazar. I am an academic cardiologist. I'm at State University of New York, Downstate Health Sciences University, which is located in central Brooklyn. A large part of our mission is to serve the underserved, and there I practice general cardiology. I direct non-invasive cardiology, which includes various forms of cardiac imaging. I also have wear multiple hats. I have a research laboratory, and I teach. I have a pretty robust practice, and I'm the Vice Dean of Education for the College of Medicine.
Awesome. Thanks, Jason. Lots of hats there. Great to have you. And Nassar, can you do the same? Can you tell us a little bit about yourself and your role at Jefferson Health?
Sure. So I'm the Chief Information and Digital Officer at Jefferson Health and Thomas Jefferson University. We are a integrated healthcare system serving Greater Philadelphia and Southern Jersey. We have about 18 hospitals, roughly 40,000 employees. My background is all in technology. I've been with Jefferson for 5 years. Prior to coming to Jefferson, I was with New York Presbyterian in New York, and before that, I was with Yale Neo and Health. I'm glad to be here.
Great. Thanks. Good to have you. So, just to dive right in, the subject of our symposium today is adoption, and you both come from, large, unique systems. So I'd love to hear from each of you right now at your particular institutions. What are the biggest, what in your experience are the biggest barriers that you're experiencing? Nassar, maybe you want to start.
Okay, sure. So look, I think in the context of health tech, right? I mean, there are a lot of opportunities and there are a ton of challenges, no lack of challenges.
No, I'm sorry, specifically to health tech adoption.
Yep, and the health app. So, and so in no particular order, right? I'll just say that during COVID and post-COVID, we saw great adoption of digital technologies, which is awesome. But with that came too many applications. Just, there was a barrage of application and solutions, which is really confusing for patients and providers, especially when you think about from a patient point of view, wellness apps, and exercise apps, and multiple hospitals. If you're a metro area like Philadelphia or New York, interoperability is another pretty significant challenge because none of these apps work seamlessly. The information is being gathered in silos. As a health system, we are always chasing interoperability just within health system. I'm not even talking about other outside apps. So that's a big challenge. I think we have made a significant progress in terms of regulatory, but there is a long way to go. Things like privacy and security and just some ethical issues are challenges that I think we face in adoption, especially when you think about the scalability of health tech. Same thing I would say around reimbursements. The digital technologies, telehealth, remote patient monitoring, while we have made great progress, we're still, I think our industry is still trying to figure out how the reimbursements are going to work in the long run. And the last thing I'll say is that at least at Jefferson, and I know it's not Jefferson issue, but with Jefferson, we we are grappling with the issues of health equity, where digital technologies and health tech is great, and it has helped many people, and it has just amazing potential. But we realize that not everyone have equal access to things like Apple Watch or technologies at home, or even just simple internet access that many of us take for granted. I think in solving health issues, and especially technology solving healthcare issues, that is something that we just have to be incredibly mindful of. Let me stop there. Jason, I think,
Yeah.
Sarah, you're on mute.
There was a giant truck driving by my house. Yeah, Jason, so, would just love to hear, at SUNY, are you experiencing, the same things, different things in terms of, I know COVID has taught us a lot about, digital health and adoption. Would love to hear your experience.
I think Nassar did a great job of summarizing the major issues. For us, I think it's very clear that healthcare technologies has adapted slower in areas that are underserved. And, there's several reasons for that. One, I think safety net hospitals lack the resources to build a robust healthcare technology infrastructure. And, digital health, and let me just say, I'm an enthusiast, I'm a realist, I'm a pragmatist, and an optimist. So, I tend to see the glass, half full, but also half empty. The patients often live in accessibility as an issue. They often live in high risers. And while there's usually broadband, it doesn't always work all that well when you combine lower income and elderly patients. They're kind of synergistic and leave a lot in terms of digital health, lack of sophistication, if you will. So I would add those issues on top, and I think I'll just mention interoperability. A lot of patients are starting to self-track. I find this less in the underserved population, and paradoxically, I think it's the underserved population that could benefit more from self-tracking, such as recording their own blood pressures. So those recordings, those self-tracking data measures are not well integrated into any form of a single electronic medical record.
Do you think self-tracking is, my next question was really going to be about, what do you see as lowest hanging fruit? Isn't the right word. What should we start with? What's the most impactful next step in terms of health tech adoption that would, make an impact, particularly as you both are talking about in underserved communities? And, is it enabling self-tracking? And, what are aside from interoperability, what do you think patients and providers need, from us as, experts in digital health? This is where it's at. What should we be working on? What should we be starting with?
I'll start. So I think there are a few things that I can offer here. Number one, it has to be a deep partnership between multiple organizations at multiple levels. So among healthcare providers, certainly, but also in between technology companies. Government, I think, has an important role to play here. Certain things like Jason mentioned, like access to broadband, for example. Certainly healthcare systems are pushing, but this is other industries can step in and help. I think so. That's one area. I think the promise where I see is in automation and things like artificial intelligence, automating as much as possible. And really, there are multiple benefits there, but one of the key benefits where I see is the driving the cost down. okay, using automation and technologies are there. Some of the things that we are doing are just, simply not available or not even an option a few years ago that we benefit from these days, especially in AI and automation. We have automated entire pathways. We have today the ability to monitor patients at home for, especially if you think about chronic diseases, COPD or CHF and diabetes care and so on and so forth. And I think a partnership, an incentive program, a clear reimbursement program that presents a comprehensive solution for patients, especially those, I think your question about those who can't afford it or don't have access, I think there has to be a program. It's just not, technology alone is not going to be a solution, right? We really need programs that are targeted toward population that we are trying to serve here. And I think that's very much possible. And there is great opportunity for us as healthcare systems to partner with the right partners, both in technology field. I'm excited about the investment that we are seeing in digital technology. It's just exciting, but I think there's pretty significant room for improvement.
Super, thanks. So it sounds like really smart partnerships are key. Dr. Lazar, any thoughts?
Yeah, I think Nassar is spot on. Technology is a tool, and that tool is part of a program. Yeah. And I think we really require a multi-pronged approach, ranging from systems to providers to patients. At the patient level, virtually all patients have some form of a smartphone. Although yesterday, one of my patients whipped out a flip phone, and I wasn't sure what to do with that. But and they FaceTime and they use the internet, but I find very few of them actually know that there's a step app. Look for that heart shaped icon on your iPhone. And I actually spend some time individually at the patient-based level. It's like, how do you build a practice? One patient at a time. How do you build digital health? One patient at a time. Providers need the tools to collect data and analyze data. And we talked about interoperability before, and that's a major issue. And then you need a systems-wide approach to, coordinating all of this. Obviously, it's a vexing challenge. I do think that the future is bright. I do think we need to recognize that healthcare adoption has greater barriers in areas which are, more underserved.
So, thanks so much, Jason, Nassar. Believe it or not, that's all the time we have. It's 12:30. There's some really nice comments in the chat. Please check them out. And I will send it back over to Stan and Jerry.
It's a great, thank you, Sara.
Thank you both.
thank you both, Dr. Lazar and Dr. Nizami, for your participation today and the great thoughts you have there. Thank you both. And lots of great chat happening in the chat box. Thank you all for that. And a couple of quick questions here. One around remote treatment, remote patient management, and RTM, remote therapeutic management, and the coding, whether it needs to evolve to better serve digital health adoption. Absolutely, there's no doubt about it. And really, one of the topics we're going to cover in the next symposium is not the rise of virtual first healthcare, but the fall of virtual first healthcare. Is it going to be around in 5 years? We're seeing a substantial pullback on a lot of the RTM, RPM reimbursements that were laid out in 2020, 2021. Some states are curbing them back. Some states are eliminating them altogether. We're seeing declines in a lot of areas around telemedicine and remote patient monitoring. So the question that we'll be talking about in the next symposium is right around, which is ironic because now we're talking about digital health technology and technology adoption, but is the fall of virtual first something that's coming through, or is virtual first actually rising and seeing greater diffusion across the ecosystem? So stay tuned for the May symposium. Be sure to sign up and be a part of that conversation because we're seeing things move quickly. And so Mike Pace, great question on that one. Thank you for that Q&A. And again, more comments in the chat box if anyone else has comments and questions there. And don't forget to add your LinkedIn links into the chat box as well. We'd love to make sure that we're meeting everybody there and that everyone is meeting each other as well. This is one of the great platforms for free open source interaction and connectivity. And remember, it's about shared perspectives. That's how we can accelerate the optimal adoption of digital health technologies, is about better understanding each other as we're winding our way through this digital technology adoption journey.